Okay, so this is part two. In this part, we're going to get into thoracic outlet syndrome. Thoracic outlet syndrome, or TOS. Look at the sources of TOS, what causes it, some treatment, talk about some posture exercises, and then the treatment box thing we'll do in a separate section because it's kind of involved. All right, so let's go on with TOS. So here's our dilemma, here's our case for the week. It's Brenda. She may sound familiar to you. She has problems with binging on Netflix. She is 24. She has pain in her neck, right side of her neck, her chest, her shoulder, and she reports numbness and tingling in her right hand as well. She also says intermittently that her right hand will go white, blanch. So she has this cluster of odd syndromes. Her job, she's out of work, she was a house cleaner, and what she's doing now is she's just binging on Netflix all weekend. She's kind of sitting on her bed, kind of like that picture. She's got the coffee, she's got the pizza, some nachos there, texting constantly, laptop constantly, watching TV with this wonderful posture here. So she wants to have no pain. It just started about 3 months ago. Key thing here, she has no history of trauma to her neck or her shoulder. X-rays, MRIs are negative. So we have to figure out, one, how can we test for what she has going on and then confirm that with a palpation. And then once we figure out, okay, I think this is what it is, how do we treat it? Okay, so thoracic outlet syndrome, what is it? These are the symptoms of TOS. Quickly, there's the cause of it. It's basically, it's basically a pinching of the brachial plexus as it comes down out of the scalenes under that first rib and then under the pec minor. That little box is the thoracic outlet. Can cause chest pain. It can literally feel like you're having a heart attack when it's just thoracic outlet. Particularly the pectoralis minor tightness can lead to this. It can make you feel like you have carpal tunnel syndrome. And everything is classic around median nerve irritation with carpal tunnel, maybe even Pornato-Terry syndrome, which we'll get into. You think, oh, that's what it is. If you're just a therapist that just kind of thinks about the hand and is stuck on the hand, when really it's all going on up in this box, this thoracic outlet. It can cause the sensory issues. This is starting to sound like Brenda, isn't it? Her sensory issues, her numbness, her vascular issues, how it's so odd how her hand is turning pale and white. Also, one of her symptoms I didn't highlight, she says when she does anything overhead, so it's like she's washing a window or reaching overhead, her hands, her shoulders get really fatigued. They feel kind of heavy and dead. So that's another kind of key thing you can see, that upper extremity weakness. What is it? Where is the source of the pain and the numbness for TOS? It's these three outlets. There's three different spots that cause it. The first spot is number one. Here's a good, better picture of number one right here. See that yellow thing is the brachial plexus, which, as you know, contains the median nerve, the radial nerve, the ulnar nerve coming down to the hand. Tight space through the scalenes. Whenever you see tight space, think space and flow. Think this is a potential source of irritation and pain because it's a tight space. If somebody's scalenes gets strained, it pushes on the plexus, cuts off the blood flow, causes all these pain and problems. And we know what causes tight scalenes? Forward head posture. Forward head posture causes tight scalenes, pinches on the plexus, causes thoracic outlet. That's number one. Number two is right here between the first rib and the collarbone. First rib and the collarbone, again right here. First rib and the collarbone. What goes underneath there? Tries to get through there. The plexus and those veins and arteries. So again, it could cause numbness. Blanching in the hand for Brenda could be caused by swelling in here, tightness in here. Again, poor posture, all those kinds of things can lead to that. Sometimes major league pitchers get thoracic outlet syndrome. What do they do for treatment? They do surgery. What do they do for surgery? They remove this first rib. They kind of cut it right out of there. Why would they remove that first rib? Can you think about that? Our theme of space and flow. If you remove that first rib, it's going to give you more space in there. It will give more space. Won't be so much irritation. Be able to kind of glide and do what it needs to do without getting irritated. Third potential spot, pectoralis minor, right here. Small muscle, big clinical implications, the pectoralis minor. Why? Again, tight space. Brachial plexus coming right underneath that pec minor. That's the third spot where you can get some irritation for TOS. Causes that kink in the hose metaphor, that analogy that we talked about. Proximal kink causes distal problems potentially in the hand. What is it caused by? Trauma, whiplash. If you whack and strain that brachial plexus, cause all kinds of awful nerve pain that can take forever to go away. Repetitive overhead motions really tightens up the space. Repetitive motions overhead causes problems. Poor posture, rounded shoulders. COPD, emphysema. Why COPD, emphysema causing TOS, you might wonder. With COPD, people are breathing through their chest. They're not breathing diaphragmatically. Generally speaking, they're stressed, a lot of anxiety. They're constantly breathing with their chest. Which muscles help with the breathing, the chest breathing? The scalene muscles. They're using those scalenes overtime, just around the clock, trying to get enough breath to survive. Strains the scalenes, pinches the plexus, causes TOS. How do you test it? You test it with a ruse test. Put your shoulders in a closed, packed position overhead, and it provokes the syndrome. I'll talk more about that. We'll do that in the lab. How do you treat it? Generally, you treat it nerve glides, because it's a nerve issue. Nerve glides are basically arm movements that stretch out these different nerves, the radial, median, ulnar nerve. Talk more about those. Diaphragmatic breathing, so you're not chest breathing, you're breathing with your stomach and a diaphragm. Also helps relax you. Train the COPD to teach to breathe diaphragmatically. Can relieve the TOS syndrome symptoms because it can reduce the strain on the scalenes. Pec minor stretch. This is a golden thing, probably the best thing you can do to relieve TOS syndrome. Stretch out the pec minor. Aerobic exercise, always good to move, get the flow going. And activity modification, we'll talk more about that in the treatment box. These are posture exercises, because posture is such a huge part of TOS and really all these shoulder syndromes that we're going to look at today. This gets into the forward head, breaks it down to overused, underused muscles, how you see what common jobs, tasks, and how you treat it. You need to know all this, really, for the midterm. The chin tuck we talked about, do the wall lineup, talk about the tilt, the Williamson exercises in work and industry. Here's a good example of scapular retraction. She's got the forward scapula, forward shoulders, kicks in her rhomboids, brings that scapula back, opens up the space in the thoracic outlet in her shoulder. All a good thing. Okay, so that's the end of that one.